Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we will learn smart strategies to handle 4 hours CPC exam, like how to pace yourself or how to prioritize easy versus through questions, and how to avoid common time wasting mistakes. Okay, all these things we will learn today, and we'll understand the tips and strategies to complete your CPC exam on time. Okay, so I hope by the end of this session, you will feel more confident and you will feel more organized with your CPC exam preparation. So if you have exam in within this year, or maybe within the month, or maybe in May, definitely this video will help you. So please do watch video till end, and please do share with your medical coding friends, and please do subscribe to my channel and support. Okay, so let's get started with the session. So the first thing, the very important and the very basic info is know the exam structure. Okay, so currently 2025 CPC exam structure and format is total questions would be 100, and passing score is 70%. That is 70 correct questions you should get, and time limit would be 4 hours. Question type is multiple choice, and there is no fill in the blanks questions. Okay, and it's an open book type, and you are allowed to use CPT, ICD-10 CM, and HCPCS level 2 code books. Okay, all these 3 books are allowed to use in the testing center. And if you are watching from USA, like, you should have your own print books. But if you are watching from India, then you don't have to take your own book to the testing center. The testing center will provide you all these 3 books. Okay, you have to use whatever the books they'll provide. Okay, and now in 2025 there is one more added feature is like they are they made changes with the ebook also. Okay, so they have gave access to ebooks. So if you are comfortable enough to use ebooks on screen, you can go with ebooks, that is digital version of all these 3 book, CPT, ICD, and HCPCS book. But if you are not sure how to use ebook, and you are not more confident with the screen presence, then definitely you should go with print books, because everyday basis you will be practicing using your print book. So suddenly if you change to digitally, then you may have the difficulties to navigate the codes. Okay, so better with the if you don't have enough practice with ebooks, you can definitely choose to go with print books. Okay, and many students will be questioning me, is there any changes in CPC exam pattern in any month? So definitely within this year, no changes will come. Okay, whatever the pattern is seeing here on screen, this will remain same for the current year. Okay, if any changes, if fill in the blanks may come, if it is coming also, it will be in 2026. Okay, not in current year. So no need to worry. Currently we have multiple choice pattern, so that will be there up to December. Okay, and if any changes are there, definitely I will only make a video and I'll inform you guys. So this is a basic format and exam structure of 2025 CPC exam. So now let's understand why time management matters. Why this time management is very important with CPC exam. Okay, why? Because we have 100 questions to attempt, that too in 4 hours. So you will get 2.4 minutes per question. Okay, 2.4 minutes per question you will be getting. So in that 2.4 minutes, you should be able to navigate the code, and you should be able to pick the correct CPT or ICD code. Okay, that is why they have allocated time frame for CPC exam. And even if you get certified, like if you get a certified professional coder license, and if you get into job, okay, like when you become an actual certified medical coder, you should be able to understand this time importance. Okay, because as a medical coder we will be working on target basis. Okay, so we will have the time allocations for each medical record. Okay, so the time allocation will depend on like what kind of project we are in. Are in HCC, then you need more time for a single medical record. And if you're in just an ENM OP or any other outpatient services, it will take some 2 to 3 minutes to deal with single medical record. And if you're in surgery, then it may take 1 hour to complete one medical record. So it purely based on which project you deal with, okay, or what kind of specialty you deal with. So just to give you that heads up, or just to make you understand the importance of time, they have created this kind of exam pattern, because you are a future medical coder, so you should be knowing the importance of time in the preparation only. In the beginning, you should know. So that is what their agenda is. So smart time use, higher pass rate. So if you utilize time properly and time wisely, and if you attempt all the 100 questions, there will be higher pass rate. Okay, so if you are in the mid range where you are scoring some 60 to 70, okay, and you are having that fear that what if I don't pass. So if you attend all the 100 questions, at least you will have the chance to get 70% or 71%. So in that range you will get, and you will get pass. Okay, but if you don't attend 100 questions due to time insufficiency, and if you just end up attending 80 questions or 85 questions, then again you will be getting some 60, 65, or sometimes 69. Okay, that should not happen. So how to attempt all the questions, even before, like, the target should be like 3 hours 30 minutes. Within 3 hours 30 minutes, your exam, all 100 questions should be answered, and remaining 30 minutes you should keep it for review. Okay, then only you should be able to score good marks. Okay, so that is what I'm going to explain step by step, on which section you have to focus on, which everything I'll explain. So just please be consistent, and please watch video till end. So the first thing you have to understand is understand your battlefield. Okay, understand your battlefield. This refers to like most of the second attempt student. First attempt, anyhow, without understanding the time management or without knowing the concepts well, you may end up got failed. So now you have one more chance, so you should use that chance wisely. So how to use, then you should know, you should understand what are your weak areas. Okay, so if you check the AAPC score sheet, the last attempt, each section score they'll display. Okay, by seeing that, you should work on those area. Like last attempt you got some ENM section only 50% of marks. Okay, then you should know that this is your weak area. You should start work on ENM section. Okay, likewise few other section you may have the less marks. So that areas you first give preference, and you should work on that. And if you are writing for first attempt, then you should not make this mistake. So whenever you are practicing through regular practice questions or regular mock paper, you should understand in which area you are getting very less marks. Okay, so that area you should give some importance, and you should take an extra practice questions on that, and somehow the basic understanding you should be very clear. So here they are saying, so all the 18 sections which you are going to deal with CPC exam, you should know the marks distribution well. Okay, and in your head, subconsciously you have to allocate time based on your need. Okay, so I'll explain how. So you can see here, some sections are longer section and harder, like you just have to prioritize based on your strength, because you are already aware what are your weakened areas and what are your strength. Like you are good at integumentary, but you are not good at case studies. Okay, so that kind of differences you should know. And also here, as you can see, this is the marks distribution: medical terminology, anatomy, compliance and regulatory. So all the marks distribution you should know. Okay, so easily. I'll tell you the tips. So see the marks distribution, and up to here, HCPCS level 2. Okay, whatever you have, medical terminology, anatomy, compliance and regulatory, coding guidelines, ICD 10 CM, HCPCS level 2, totaling 26 marks. Okay, so 26 marks equals to 26 question. So you will get you will get around 1 hour to answer for this portion. Okay, 1 hour. Do you really need 1 hour to answer these direct questions? No need. Okay, within 30 minutes, you should complete this 26 marks question section. Okay, so if you save 30 minutes in this area, you can utilize the extra 30 minutes in other harder area, like where you feel more difficult, or maybe you can flag some questions, and then when you have the last 30 minutes, you can have the time to review those flagged questions. Okay, so wherever you can save the time, wherever you really don't require 2.4 minute per question, you need to save the time. Okay, and you can utilize that saved time to the required area. Say, for example, case study. Case study may require 3 minutes per question, or 3.5 minute per question, so that you can utilize in those harder areas, and you can somehow easily complete 100 questions within 3 or 30 minutes. Okay, within 3 or 30 minutes, you should attempt all 100 questions. That should be your target. Okay, you don't really think 4 hours is a duration. Think like you have 3 or 30 minutes as your final exam duration. Okay, that 30 minutes, what you will get, that would be your grace. Okay, that is grace time, which is kept for a review. Okay, without review, really, you may end up getting fail, or maybe you may end up getting less marks, like 75 maybe. It's a good marks, but when you have the actual review time, you can get a better marks. Okay, if you have studied everything, and then you don't have to feel bad. Okay, I have studied so much, but I only got some 71 marks, 72, 73, all like that. Few students will think that is a good marks, but still it depends on individual. Okay, so next I'll just tell you how, for each section, how much marks is needed. So see here. So we say first scan strategy. So the meaning, you have to start with the easy portion. Okay, don't go and start case study when you open your exam. Okay, no need that. Case study, you're already not sure why you have to spend so much time. So you should attempt these, whatever I have highlighted here, 26 marks. Okay, this 26 marks, within 30 minutes, if you're able to complete. And also remember, all these are direct questions which we are already discussing on everyday basis, right? I am only making videos on what are the important medical terminology for this year, and what are the compliance questions they are asking. So if you follow all those, and if you have those list of questions that they are asking, easily, not even 30 minutes, within 15 minutes, you can complete these 6 set of sections. Okay, and in your pocket, you should be able to have at least 25 marks. Okay, at least 25 marks already, it will be in your pocket within 15 minutes. So this is like an add-on advantage for you to get past CPC exam in a first attempt. Okay, so next, coming to surgery portion. So no, the surgery is, each chapter is distributed for 6 marks. So totaling, you have to deal with for 36 marks. Okay, 36 marks you will be getting. So each section you will be getting around 14.4 minutes. Okay, 14.4 minutes for each section you will be getting. So conclude that, so totally you will be able to get around, for this 6 section, some 86 minute you need to complete. Okay, in 86 minute you will get. So in that time you need to complete the surgery section. Since you have saved some 30 to 40 minutes in the first section. Okay, so you can take advantage of that 40 minutes. So if you still have any doubts, so like for your elaborated review, you can utilize some 10 minutes extra here. Okay, so because you already saved some time. And same way, next set also, radiology, pathology, this is for 6 marks. So next, anesthesia, 4 marks. So up to here, totaling both surgery and non-surgery, you may end up using 150 minutes of your time. Okay, 150 minutes of your time for answering these two. Okay, and still you have how much time? So this totaling these two section, you have taken 150 minutes, and here if you have taken some 30 minutes, so 150 plus 30, 180 minutes. Okay, 180 minutes done. Remaining is case study. Okay, there will be 10 questions for case study. So if you calculate 2.4 minutes into 10, you will be getting 24 minutes. Okay, but still you have so much time. 150 minutes is over, and with the 150, so like 150 plus 30, 180 minute is over. So for this, you can utilize for case study 24 minutes is an actual time. You can still take some 6 minute extra and use for 30 minutes. Okay, 180 plus 30 you will get. So totaling 210 minute is over. Within 210 minute, you have attempted complete CPC exam syllabus. So you left with remaining 30 minutes, right? 210 minutes is over, remaining 30 minutes you left. So whatever flagged questions you marked, maybe in integumentary there is one flagged question, and in the surgery like respiratory and cardiovascular there are 3 flagged questions. Okay, what you have to do with this extra grace 30 minutes? You should go and review those flagged questions. Definitely, you can answer those flagged questions easily. Okay, I will tell you how to answer those flagged questions. Okay, I will give you one tip on that also. So far, I think you got some idea on time distribution. Okay, it depends on the individuality. So please, so that's why I have given break exam into 15-minute blocks and 25 question per hour. If you keep in your mind like you need to attend 25 question per hour, then you are good. And also monitor your pace every 30 minutes. Sometime when you are struggling with any questions, you may start forgetting how much time is running. Okay, that's why it is important. Once you complete one section, say for example you completed answering 6 question of integumentary, just see the clock, how much time you have taken. Okay, likewise make sure you check the time for every section, and then you can skip the tougher question. Okay, so you got one difficult question in digestive system. Don't sit or don't be, waste the time like checking or navigating too many codes, too many guidelines. No need. Once you understand, okay, it is not working, flag that question and select some relevant answer. Okay, so select some option, flag that question. So last 30 minutes, you can take the time and you can come back and review that. Okay, so then what we have to do? The 3-pass method says easy questions first, medium difficulty next, and tough question last. So that is how the pattern is actually is there in CPC. Okay, so easy question is like all these are very easy. So complete this first. These two are moderate. Surgery and non-surgery portion are moderate thing. Lastly, case studies you may feel little difficult because it is an operating reports. Okay, it is also like actually practice question, but you feel like it's a case study because there will be too many the question will be big, like they will mention what is pre-operative diagnosis, what is post-operative, what is the procedure they have performed, what are the complications they have faced, and what is the final diagnosis. Okay, so what are the instrument they have utilized. So it's like surgical report, so you need to read all those. So that's why you may feel case study is difficult. Okay, so that is why you can take easy first, medium second, and tough questions at last. And as I mentioned, time checkpoints are very important. Check the progress, like how much questions you have answered in how much time is left out. Okay, so that is important. And don't get stuck. Move if you stuck for 2+ minutes. So in one question, if you are taking more than 2 minutes, means immediately you need to move to another question. No need of giving 5 to 10 minutes for single question. Okay, don't make this mistake. I'll repeat. You may know the answer, but time is like it is going, right? So you cannot take that risk. You are like each question is allocated with 2.4 minutes, but you are taking more than that, then the question is draining your time. No need of getting that one mark and move forward. Okay, within that same time you may end up answering 10 right answer, we don't know that, right? So that is why that flagging is very important. So next, what if you flag questions? And as I said, that last 30 minutes you need to keep it for review. Okay, so in that review phase, that flagged questions will be there, right? So you already don't know the answer, but you have selected some option, but still that option sometime can be correct. Okay, so how to do that? So that is smart guessing. Okay, smart guessing, and you need to follow the reversal method. Okay, reversal method is you can eliminate two wrong answer, like which are completely irrelevant. Okay, so if you are unable to do that, what you will do? Check the four option. The reversal method says, like normally we will read the question or we will see the key procedure and then we will see the option, but you have read the question but if nothing is understanding in the question. What you will do? You follow the reversal method. You will check what is the option description. Okay, option A is what, option B is what procedure, option C is which procedure, option D is which procedure. Likewise, reversal method you have to apply then. So when you apply this reversal method, when you actually go and refer each option code description, somewhere you will understand which option is very relevant to the question or the procedure that they have performed. Okay, so that is called smart guessing. So in this, if you actually don't know the concept, but somehow by reading the documentation or by reading the code description and the documentation, some codes are related. Okay, that code you can choose. Okay, as your last, while unflagging you can choose that, choose as your right answer. I mean, you may selected initially, you may selected option A and flag that question. Okay, and while reviewing, once you go through all the option description, you may feel like C description is more relevant to the procedure. Then change that option, select option C as your answer and unflag the question and move forward. Okay, that you should do. And then, so see, make educated guesses when needed. That is important. So whatever I said, if you follow the reversal method, you can 85% you can end up getting the correct answer only. Okay, and then next tip is codebook use and fast navigation tips. So as I said, if you are familiar with the ebooks, you can definitely use ebooks. Okay, so it will give you code even faster, but only when if you don't know how to use the monitor or screen properly, because you're already, as soon as the exam start, you are in the panic mode. Okay, you will be like, what if I click this? Sometimes few coders will not even use enm calculator or not even use notepads, because they'll be like having that fear. Okay, what if I click, what will happen? So something will be there in their head and they don't take the chances also. Okay, that's why when you are using ebook, you need to minimize the screen and you have to switch the tabs, like three books will be there. And so it may feel difficult as a fresher. Okay, so as you are regularly practiced with the print books, I suggest you go with the print books. Okay, and so here how to use book is very important. So like if you are familiarized with a CPT book, definitely CPT will help you, because in the CPC marks distribution, if you see, CPT portion will give you more marks. Okay, even if you don't know to how to navigate ICD book and HCPCS book, that's okay. But CPT, you should be very strong and follow the index method. Like first, while opening each chapter, check the index of the chapter and see what are the direct procedures you have, or see what are the procedure this complete chapter include. Okay, so at least know the code range. Integumentary 1 series, musculoskeletal 2 series. Likewise, basic code range info is also enough. And if you are from India, as I mentioned, we will not be able to take our own books. Even if we are tabbing and highlighting the coding guidelines and writing down any important notes, it will not be more helpful during the exam, because our book will not be with us. Okay, but it will help during the practice. But if you are from USA, you can follow the tapping method. You can highlight whatever the coding guideline is there, and you can mention the note, like little info or key points you can write down in your book, so that it will definitely help you even better. Okay, and a few things, how to get the code, like the meaning of standalone code, meaning of intended code, and add-on code. Okay, all of these symbols, so everything you should know. The basic fundamental should be very strong. And then comes to practice. So how much practice you will do, that much perfection you will get. Okay, so you just have to practice, like as I said, for CPC preparation, if you dedicate yourself, 1 month is enough. Okay, because few students, what they will do, they will take 3 month training program, and within the during the training they'll not practice anything. Okay, they'll just listen to the class and they'll come and they'll sleep. Okay, it goes like that. 3 months will be over, and after that, after their training, they'll start practicing, and while practicing they'll get many doubts. So to solve their doubts, nobody will be there, because already their course is completed. Okay, and then they start feeling like, okay, I'll take next month, I'll take next month. So likewise, they'll keep procrastinating. Okay, that procrastination will spoil your knowledge also, and you feel like, okay, I'm not feeling confident. So many things will come to your mind. So that if you are joining 3 month program or 1 month program like my course, prepare yourself, and then like, okay, I am going to take exam in May month. Okay, that should be in your head and you should join, and accordingly you have to work. Okay, so for that I have also make down the list, like what and all you have to practice. Like week 1. Okay, week 1 you can take basic. First, understand the coding guidelines. Okay, just see what is there in book. Okay, turning the pages is important in the initial week. And then, like the training period I'm saying, okay, once this training period is over, once you understand the concept, the preparation week is for 1 month. So in this preparation week, you can take one day, you can keep one chapter for review or for practice. One day is for anesthesia, second day is for integumentary. So you need to check the concept, allocated coding guidelines, and at least you need to practice some 30 to 35 regular practice questions. Okay, and see how much marks you are getting in that 35 questions. Note down how much marks you have secured. Okay, and also correct yourself wherever in out of 35 questions you may end up getting some 25 questions correct, remaining 10 is wrong. Means check those wrong, like 10 wrong questions, what is the correct answer, why is it correct, what coding guidelines they have utilized there. So all those you can mark. Okay, so same thing you should apply for all the surgery section and non-surgery. Okay, and then one week for surgery, another week for non-surgery, and then 1 week you can completely keep for case study and ENM review. Okay, ENM we have many services, so you can keep an extra time. That is okay. And lastly, you can keep it for revision. While reviewing, you can keep the 26 marks, whatever anatomy, terminology, medical studies, all those whatever we have guidelines, that can you can keep it for some 2 3 days review. Okay, so if we are completely new, then depends on an individuality. So you may have the dedicated time for 2 months also. That is also good, because I cannot say I am taking 1 month and you should also take 1 month. That will not work. It depends on your goal and how much time you are dedicating yourself for CPC. Few will be working, so that they may not able to give even 1 hour for a day, but few will be students, they'll have full time, so they can dedicate themselves completely morning to evening. Okay, it totally depends on individual. So that plan whatever is feasible for you. Okay, but do not procrastinate and do not give gap. So if you start giving gaps, then you may start pushing your exam plan next year, next month, likewise it keeps going. So dedicate yourself and do the practice mock papers. Okay, like as if you are taking a real exam. Okay, so see, simulate real exam conditions. So you should create an environment where you are actually taking an exam. So don't wake up for 4 hours. Okay, so sit in a same place and take the exam or take the mock paper. Complete that mock paper. So you will feel more confident and you feel like okay, you are now ready to go for exam. Okay, so take timed practice exam. That means use the clock and take the exam. Okay, and identify and fix your time traps. So see wherever which area you are taking more, wherever or which section is taking or consuming more time. So that area is a weaken area for you. That's a weak area. So you have to give some time for that particular section, and then you need to work on that. Okay, to build the stamina or the strength towards the subject. Okay, and then last thing is very important: stay calm and focused. This is very important. Mindset is a management. Okay, as I said, do not think you have 4 hours to complete the exam. Think you have 3 hours 30 minutes to complete the exam. Okay, you have to train your mind in such a way you have 3 hours 30 minutes. That extra 30 minutes is for grace. Okay, that 30 minutes you can keep it for review. And see, I'll tell you. So I think I have mentioned earlier or not, I forgot. Today only the student I can put a screenshot also. So if I can show, okay, I need to take WhatsApp. Okay, leave it. But the what the student did was, like, with for that nervousness, she attended some 55 60 questions, and she said there is a glitch, but I don't know what happened. She also don't know what she did. Okay, she submitted the exam. Okay, just by answering 50 55 questions. So she got fail, and she asked for AAPC help. So that AAPC has said that we cannot give you an extra voucher. So we need to review what was the technical glitch, and technical glitch will not happen. But if it is actually happened, then we need to see the testing center video footage. Okay, based on video footage we will decide. Likewise, they have given a response, but they don't actually take that much effort and they go and review all those. So the student has to take one more attempt to write the exam. Okay, that is why you should be very calm. You should be calm whether you know the answer or don't know the answer. Just be calm, and then use your mindset, and whatever you have learned, try to remember, and then you can start answering your question. That panicness will be there. Okay, initially when you walk in, that the environment will be like very pin drop silence will be there, so that you feel more conscious. Okay, so that and all it will happen, but you have to practice your mind likewise, because if you take a mock paper in an actual as I mentioned, simulate real exam condition in your home. So if you practice the same real kind of conditions in your home for 2 days, you will uh, get this calmness when you're actually taking the real time exam. Okay, and breathe if you stressed. So if you, like, if your hands are shivering, or that panicness is there, means just 5 minutes, take a deep breath, and train your mind that you will complete your exam and you will attempt all the 100 questions, and your goal is you have already passed. Okay, likewise you should be very positive and focus on questions and answer. Okay, that is the ultimate tips. And lastly, the final tips are, you should go early. Okay, testing center, maybe you are having the exam at 10:30. Okay, 10:30 a.m. So please try to be there at 9 o'clock, at least 9 o'clock. Okay, so that you can meet the proctor if proctor comes early, and they will see your whatever the documentation is required for verification. Nowadays, the digilocker should be there. In digilocker there should be Aadhaar card and PAN card that you can show to them, and make sure your first name and last name is as per as your Aadhaar. Okay, and whatever uh, as I said, if you are from USA, make sure to bring your book. And if you are from India, you don't have to bring your books, but documents should be clear. And trust your training, trust your mentor. And as I said, time management is very important. Okay, so time management will decide you whether you will pass or not. Okay, so these are your final tips. So I hope I have covered whatever is needed for the exam. Okay, so the training part is different. Training part, if you join my course, you will get it. Okay, so CPC revision course is for people who have taken the training and who have failed in exam. All those can attend CPT classes. But if you need, if you're a beginner and if you want complete CPC preparation, then you need to join my complete course. Okay, so that with my classes you will definitely pass if you follow my classes, and if you follow my tips, whatever what I'll share, or whatever the question I'll discuss. Okay, so that is what I wanted to bring this for today's session. So yes, you have got this. I think you are ready for now. So if you are attempting exam within this month or May month, best of luck for you guys. Okay, good luck on your preparation. So be positive and attend all the questions, and I wish you all success. Okay, so thank you for watching this video. I hope you got some insights. Okay, if you really got few insights from this video, please leave your comment and support. And please do share with your medical coding friends who are writing CPC exam. Okay, with your friends you can share. Okay, so that's all. Follow me on Instagram for regular updates, and follow me on LinkedIn for job updates. So yes, that's all. Thank you all for watching this video. Bye bye.